Hello everyone. In this video I'm going to be demonstrating how to properly draw blood in an appropriate manner using the correct tubes, and also I'll be mentioning any special handling that is required for the test. Okay, let's get started. So I will knock, I will greet my client, I will explain to the client why I'm there. I'll let the client know that I'm here to collect some blood as ordered by the physician. And I'm going to ask my client, in this case I'm using my son because I don't have a hand, so I'm going to use his hand as to demonstrate. So I'm going to ask my client's full name and date of birth, and I also have to ask if my client has had anything to eat for the last 12 hours. And the reason why I'll be doing this is because I have one of my blood draws that I'll be doing involves the comprehensive metabolic panel, and with this blood draw it is always required that the client do some fasting to avoid or altering the results of this blood test. So I'm going to find out if my client has had anything to eat for the last 12 hours. And after I do that, I will also ask if my client has any concerns or any questions for me. And if there is no question or concerns, then I'm going to set up my stuff. So here I have my biohazard Ziploc bag that I'll be using to place my tubes in it after I'm done with the blood draw. I have a set of gloves. I'll be using this as my tourniquet. I have the antimicrobial wipes that I'll be using. I have a tube. I just have one of it, so I'll be using it to demonstrate the blood draws that I have. And then I have a sterile gauze pad. I have a tape that I'll be using, and I have my plunger and a needle attached to it. Of course, I'm not going to be using the needle, it's just for demonstration purposes. And then lastly, I have this as my absorbent pad that I'm going to place under my client's hand. Put it here. Then I have this little red bag as my biohazard container or my sharps container, and here I'll be placing my trash and any needle that I'll be using. So let me clear the space so that I can place my client's hand. Place it here. Place it here. Okay, now I think I have all my stuff within reach. In this video I'll be demonstrating, or I'll be performing 4 blood draws, and these blood draws include a comprehensive metabolic panel, just like I've mentioned before, which uses the gold cover, and a complete blood count, which uses the lavender bottle cover, the prothrombin time, which uses the light blue cover, and the troponin level, which also uses the gold cover bottle. And following the order of draw, I am going to be drawing the light blue cover first, and then the gold covers, because I have 2 of them, followed by the lavender cover. Now I'm going to wash my hands. I'll wash my hands, dry them, and I'll put on my gloves. I have my gloves on. Now I'm going to place my absorbent pad here so that my client can place their hand. Please place your hand on the absorbent pad. I have my client's hand there, and straighten out your arm for me, please. I'm gonna pull up your shirt here. So while I do this, I am going to place a tourniquet on his hand after he straightened out his hand. So I'm going to place my tourniquet, and I'm going to place this about 4 to 6 inches just above the elbow. I'm not going to tie it so tight. So I have it right there. Now I'm going to ask my client to make a fist while I palpate the vein. I palpate for the vein. That is the antecubital fossa. It's right here. It is antemedial fossa. Now I have my vein. I am going to get my antimicrobial wipes that I'm going to use. I'm going to put it in my trash. So I am going to clean the site, and I'm going to start from the center in a circular motion like this, and then I'll move away about 2 inches from the site, and I'll throw that into my trash, and I'll let it air dry for like a minute. Once it's air dried, I'm going to, let me bring my stuff closer. Once I let it air dry, I'm going to pull back the skin. So actually this is not the right one, but I'm just going to use it for demonstration. So my tube will be down here, and I'm going to pull back the skin, and I'm going to place my needle to align the vein, and I'm going to tell my client that he's going to feel a little pinch. So I am going to place this needle into the skin at about a 30-degree angle right there. Once it gets in and I see that it's in place, I'm going to place my tube in there. Once I notice some backflow of blood, I'm going to ask my client to release their fist. Right there, release your fist. And once my client release their fist, I'm going to pull back the plunger a little bit. As I gently pull back the plunger, I'll check for proper placement in the vein, and if the needle is properly placed in the vein, and then I'll take out or remove my tourniquet. As I remove my tourniquet, I'm going to let some fresh blood flow into the vein, and then I'm going to gently pull back the plunger. I'm going to fill the tube, of which in this case is going to be tubes. I'm going to fill it with the required quantity of blood, and once I do that, I am going to take the tube out, and I'm going to mix it with the blood. I'm going to mix the blood and the additive that is in the tube by inversion at least 8 times, and doing this is to ensure proper incorporation of the blood sample. So I'm going to repeat this process for all the 8 tubes. Remember, I had mentioned before, the first one that I'm going to do is the light blue, and the second one will take the gold covers, and the third one will be the lavender that I'll do. So I'll place this on a clean surface right here, and I'll consider that I've done all of my tubes. And after doing that, I'm going to ask my client how they are faring. I'm going to ask my client how he's doing. Then I'll remove the needle from the vein. But before I do that, I am going to place my sterile gauze pad right above the needle, and then I will gently take it out while applying pressure on there. Then I'll ask my client to hold it and press and give it a firm press to make sure there's no blood coming out. Then I'm going to use my tape. So I'm going to use my tape, and I'm going to tape it. Take your hand. I'm going to tape it right there. Still apply some pressure, please. And then I will discard of my needle in the sharps container right away. So after this process, I'm going to label my tubes. In this case, I have just one here, but I'll consider them to be 4 tubes. So I am going to place a label on my tube, and this label is going to carry the client's name, the date of birth, their ID number, and if it's required, my initials, and also today's date right there at the bedside. Before I do anything else, I'm going to label the tubes, all of them, and I am going to place them in my biohazard Ziploc bag. I'm going to place them there, and then after that, I am going to check the venipuncture site again to make sure that there is no blood coming out, which is clear. And then I'm going to take off my gloves. I'll take off my gloves and I'll put it in my trash. After I do that, I'm going to wash my hands, and I am going to clear the table of any trash that I have and put it in the trash can. And then I'm going to ask my client again how they're doing and if they need anything before I leave. I am going to lower the bed to its surface position. I'm also going to lock the wheels of the bed. I'm going to raise the rails of the bed where it is applicable or where necessary. And then I'm going to give the call light to the patient within reach. And then pretty much that is it. And then I'm going to take my specimens that I have in my Ziploc bag to the laboratory. And that is my video. I hope you guys enjoyed it. Thank you.